So the next is lateral ankle palpation. In previous lecture, we have already discussed landmark that could be palpated over the medial side. So lateral में क्या होता है? Let's have a look over the landmark. So basically, these are the some important landmark, especially for learners or students. So what are that? All those landmarks, basically lateral malleolus, peroneal trochlea, base of the fifth metatarsal, peroneus longus and brevis tendon, and calcaneocuboid joint, position of lateral ligament, anterior tibiofibular ligament, not only anterior tibiofibular ligament, but also your posterior tibiofibular ligament and tibiotalar ligament. So these are the landmarks. Let's start with the lateral malleolus. तो क्या होता है? This is the first landmark that have the equal importance as the medial malleolus, and it is basically used for localization, and all the points are used for reference. So basically this picture is showing the location of your lateral malleolus. So it is marked here, and if you compare the lateral malleolus, it is more prominent as compared to the medial malleolus. As compared to the medial malleolus, it is more prominent. So even with the observation, we can identify the location of the lateral malleolus. But rest of the bony as well as the soft tissue landmark can be identified on the basis of this reference point. So that's why this is the first landmark that is used for localization. तो सबसे पहले हमें आइडेंटिफाई करना है, and then same like this you have to mark it, and all the means it is representing the complete location of the lateral malleolus. But some point of this landmark is used for reference to identify different bony as well as the soft tissue landmark. So this is the anterior margin. This is the anterior margin. This is the posterior margin and inferior margin. So first of all, we can identify the first structure, that is your location of, basically these are the three bands. One is we will discuss later. First I think I have to discuss the peroneal trochlea. So after identification of lateral malleolus, we have to slide the finger pad down. It is about 1 centimeter. It is located about 1 centimeter, but it may vary in individual. तो क्या होता है, कैसे आइडेंटिफाई करना है, हमें उस पर फोकस करना है. लिटरेचर में क्या मेंशन है, दैट इज इम्पोर्टेंट, बट व्हाट आर यू परसीविंग, और क्या आपको पेशेंट में मिल रहा है, दैट इज मोर इम्पोर्टेंट. So first of all, you have to identify the inferior angle or inferior margin of the lateral malleolus. Then slide your finger a little bit down, and with gentle pressure, gentle circular palpatory technique, you have to perform and try to identify the small bony eminence, that is your basically representing the peroneal trochlea. And what is the importance of this peroneal trochlea? You can say it is a structure which is acting like a pulley. Basically, it directs the force of the peronei or peroneus muscle. In this picture, we can also observe here because of the contraction, it is basically the location, combined location of your peroneus longus and brevis, the both tendon is combined here and runs one another in downward direction. At this point, basically it separate this structure separate the peroneus longus from the peroneus brevis. So peroneus brevis passes from the above or just above this structure, and peroneus longus passes through the just below the peroneal trochlea. So if you follow this tendon, first of all you can understand this. This is the combined tendon. It is coming down, and here this is the location of peroneal trochlea. This is the location of your lateral malleolus, and you can see that this tendon is coming towards the base of the fifth metatarsal. Another tendon is passing just below the peroneal trochlea. So basically it separate these two tendons from one another. So we can identify, first you can identify the peroneal trochlea, then if you further follow the tendon of peroneus brevis, you will ultimately reach over the bony position, that is your base of the fifth metatarsal. Next is another alternative method. If you want to identify the location of uh, fifth metatarsal directly, so we don't have to follow this method. Just you have to place your finger pad over the lateral side of the heel and then slide it in towards the direction of little finger. Just apply a firm pressure, slide your thumb pad towards the little finger, and ultimately you will strike over a bony position. That will be your base of the fifth metatarsal, and it is very important location for orthopedic condition. Basically, uh, here a fracture occur, that is called the Jones fracture, and which is related to the your base of the fifth metatarsal. Now come to the next structure. We have done identification of lateral malleolus, peroneal trochlea, and base of the fifth metatarsal. And we have also done the identification of peroneus longus and brevis. Next is calcaneocuboid joint. So for identification of calcaneocuboid joint, see, when you slide your thumb pad to identify the location of base of the fifth metatarsal, same time if you are keeping passively, you have to pull the forefoot in inversion and adduction. Just grip the forefoot and bring it inversion and adduction, and that lead to the separation between your calcaneocuboid joint, and apply little bit firm pressure over here and perform inversion and eversion again and again with adduction and abduction, and appreciate the movement between these movements. You have to place your thumb pad little bit more proximally from the base of the fifth metatarsal. Even if you are not doing anything in neutral positioning, you just slide your finger pad and you will find some irregular bony consistency. At that point, you have to maintain your pressure and perform this adduction and abduction and appreciate the movement between calcaneocuboid joint, and that will be your, and you can identify. Now come to the next structure, that is position of your lateral ligament. Lateral ligament. So lateral ligament, basically how many ligaments are there? Yes. You can see here the three ligaments are shown in this picture. Posterior talofibular ligament, anterior talofibular ligament and calcaneofibular ligament. So this is the location. Basically, it is the attachment between the calcaneum and inferior margin of the fibula. Next, anterior margin is completely covered with anterior talofibular ligament. Same way, the posterior margin of the fibula is covered with the posterior talofibular ligament. We can easily identify this calcaneofibular ligament. Just identify the complete margin, position your thumb pad just inferior, or you can say inferior margin of the lateral malleolus, and apply firm pressure and perform transverse palpatory technique. If you are not able to identify elastic band like structure, then bring the calcaneum and foot also in inversion, or you can say supination, whatever. You have to bring it inside and apply transverse palpatory technique. Basically, this position creates the tension, lead to the tensile stress over the calcaneofibular ligament, and this facilitates to identification of the lateral collateral ligament of the ankle. So it's all about, I think, most of the structure we have discussed. Here we can also identify the talus, head of the talus. It will be remain same as we did from the medial side. If you want to identify the uh, uh, any pathology, or you are suspecting anything, suppose a patient is injured and there is in this location, a patient is complaining of pain. So it may be because of the involvement of your anterior talofibular ligament, and you have to keep your finger pad just anterior to the anterior margin of the fibula, maintain the pressure and bring the leg in more inside, and depending upon the response of the patient, you can decide or you can suspect that there may be the involvement of your anterior talofibular ligament.